assistance programs. My name is Stephanie Fahuri. I'm the supervising attorney with the Cancer Legal Resource Center. And if I am not able to answer all of your questions today, I will try to leave some time at the end for questions, but please know that you can always contact us at 866-THE-CLRC or at our online intake form at clrcintake.org. And we also have additional materials available at our website, cancerlegalresourcecenter.org. So we're going to break this down into a couple of different sections. Obviously, when someone is diagnosed with cancer or starts going through treatment, the bills that start arriving can be overwhelming, and potentially you're not able to work anymore, or you're working less, so there's less money. So one of the ways to try to get ahead of some of the financial issues that you might encounter is to start with budgeting. And so I want to take a quick moment to go over a few basic concepts that are going to serve you well throughout your dealings with money matters in the cancer context. So that's budgeting for monthly expenses by documenting and calculating where money comes from and where it goes. So when figuring out your monthly expenses, it's important to first look at what your fixed monthly expenses are. So those are the ones that don't change very much on a monthly basis, and look to the types of expenses that do change. So a couple of examples of some fixed monthly expenses that don't really change much from month to month are your rent or mortgage, maybe your utilities, although obviously that can vary from season to season if you're paying for air conditioning or heat. But generally your insurance premiums don't change too much from month to month. Groceries, although the exact amount might change, it is a fixed cost. You're probably buying groceries every single month. And then other things like car payments, maybe student loan payments, stuff like that, car insurance, etc. So then you can figure out your other variable monthly expenses. So some of those might be gas, clothing, vacation, yeah, right, and entertainment. So obviously some of those things might go away when you're facing a health crisis and potentially very high medical bills. Probably not a lot of you are going on a lot of vacations. And your gas costs might increase because maybe the treatment center that you're going to is further from your house than maybe your job was, or something like that. So it's important to look at both your fixed and your variable monthly expenses. In terms of health-related monthly expenses, these are sometimes predictable and sometimes not. So accordingly, some of these costs can be hard to estimate, but it's always better to assume that costs will be higher and prepare for that possibility when you can. You might want to discuss them with your doctor so that you can plan accordingly. Some people feel comfortable talking to their doctors about, how much their treatment is going to cost. Others really don't, but it can be a very important thing to discuss with your treatment team ahead of time, because it's possible that there might be alternative treatments or alternative prescriptions or medications that might be less expensive but would still be just as effective. So, you should probably assume that your doctor is not aware of your financial situation. And if the doctor himself is not the person that you feel, himself or herself, is not the person that you feel super comfortable talking with, certainly at least talking to someone else on your healthcare team about what your other options might be can sometimes be very helpful. So some of the examples that might fall under the category of, health-related monthly expenses would be out-of-pocket medical expenses like your co-pays, your deductibles, insurance premiums, but also prescription drug costs. Maybe if you're anticipating a hospital stay, your travel costs to and from treatment, or if you have to stay in a hotel in order to, go to the treatment center of your choice. Sometimes there might be experimental treatments that might not be covered by your insurance. And, a couple things to keep in mind about when you're paying medical bills is it's a good idea to pay by check or possibly by credit card so that you have a record of the payment as opposed to paying with cash. And if you do pay with cash, it's a very good idea to get a receipt from the doctor's office or from the hospital. You should also save and file all of your bills, your payment receipts, canceled checks. A lot of times now, I think almost all banks have all the canceled checks or at least a record of the canceled check available online. It can be also a good idea to keep a daily log of events and expenses, and also maintaining a list of team members and all other contact people with their phone numbers and other contact info and fax numbers, so that it's easy for you to access some of that information if you don't happen to have it on hand. So once you know what income you need every month based on what your expenses are, it's important to keep good records of what goes in and out so that you're not suddenly surprised when it turns out it's time for you to pay your rent and you had sort of forgotten that that's due on the first of the month every month. So after you know how much you're going to have to budget for each month, make sure that you're sticking to that budget by documenting everything that comes in and out of your accounts. So a couple of tips: again, pay bills by check if possible so that you can have a record of the payment. Sometimes landlords, you can request payment, a receipt from your landlord if you do pay by check. And even though a lot of hospitals, doctors' offices, etc., they will send you a copy of your receipt, sometimes that stuff falls through the cracks, so it's a good idea to have some sort of record of it from your side as well. And then again, keeping a good log and maybe having an accordion file or something like that where you file all of your bills and payment receipts. Unfortunately, too often we find with our callers that even when people are living on the strictest of budgets, the combination of medical bills plus less or no income from work still leaves people short. So we're going to go over a number of programs, resources, and tips that will hopefully help with potentially paying some of those bills, or so that you can maximize the amount of income that you are currently receiving. Okay, so we're going to change gears a little bit here to disability insurance. Many people with cancer or with a history of cancer are not able to work the same way that they were maybe before their cancer diagnosis. So I'm going to go into a couple of different programs that can potentially replace your income while you're not able to work. So there are 3 different ways to get disability insurance, and I'm going to go into each of these in a little bit more detail. But here's an overview of the different types of disability insurance options that can get you some kind of income while you're not able to work. So generally, disability insurance is a form of insurance that pays a portion of your income, usually somewhere between 55 and 70% of your income, in the event that a temporary or permanent disability prevents you from working. Disability insurance is a way to have some income while you're not able to work, and there are different types of programs which include state, federal, and private benefits. And so I'll go into each of those in a little bit more detail now. So one really key point to remember is that some people might be aware of a law called the Americans with Disabilities Act. We've given webinars and presentations about that on previous dates. We do have those available on our website. But it's important to keep in mind that the definition of the word disability really varies from law to law and also varies in different contexts. So if we're talking about disability benefits through the state, their definition of disability might be different than if you're applying for Social Security disability benefits. And that also might be a different definition from a private disability insurance plan. So, I'll talk a little bit about what those different definitions are, but it's important to keep in mind that just because you meet one person's definition, you might not qualify for another program that uses a different definition. So words are very important here. Okay, so first, private disability insurance. Especially in the context of private disability insurance, it is very important to look at your specific policy's definition of disability. Now, not everyone has a private disability insurance policy. These are usually offered as a benefit through work. You can also purchase individual policies directly from an insurance company, like Aflac or MetLife or some other private disability insurance company. But usually you do have to sign up for one of these plans before you get sick. So even though the Affordable Care Act has made some major changes with respect to health insurance and the fact that now health insurance companies can no longer discriminate based on a pre-existing condition, that law does not apply to disability insurance. So if you get diagnosed with cancer and then try to purchase a private disability insurance policy, they can potentially deny you based on the fact that you have a pre-existing condition. So, this is one of those things where you have to plan ahead. You have to, weigh the risks ahead of time before you ever get sick to see whether or not it might be worthwhile. But once you are sick, unfortunately, it would be difficult to get one of these types of private disability policies. Okay, so private policies, if you do have one, are governed by contract law. So the terms and conditions vary by plan and by the options that you've selected. So, for example, some policies may cover specific disabilities and not others. So some people sign up for cancer-specific plans, or there might be a pregnancy-specific disability plan. So what your private disability policy has to cover is really going to depend on the contract that you signed with that insurance company. So it's always important to have a copy of your disability insurance plan and understand the plan's definition of disability to know when and how you would be able to receive the wage replacement benefits. Some policies will allow for partial disability. So let's say you were working full-time, you had to start treatment, and then you reduced your work to part-time. Some insurance plans might say, okay, well, we'll help, a little bit with the wage replacement for that partial disability, because you're not completely disabled, you're not completely unable to work, but you have reduced your income. We will kick in a little bit extra for that. Other policies will say that they will not pay anything out unless you're completely disabled, so it really just depends on what your plan says. So, so it is important to have a copy of that policy and really understand what the terms are. So another issue that we sometimes encounter here at the CLRC is that, again, maybe not everyone has read their private disability policy super carefully, and so they are surprised when they find out that not only are they required to apply for any other disability benefits they might be eligible for, but that their private disability policy is only going to offset those additional benefits. So what that means is most private long-term disability plans do require you, as a condition for having private disability insurance, to apply for Social Security disability insurance or supplemental security income. And I will go into more detail about both of those programs. So these plans, these private plans, will usually offset, which means that they reduce the amount of your monthly payment once you get that other income. So it's important to realize that you're probably not going to be able to get both benefits fully. So for example, let's say once you stop working, you apply for your private disability, your long-term disability policy that you have through work, because you know that you're not going to be able to go back to work for a while. Maybe they start paying you $1,600 a month as your wage replacement. But if they say that you have to also apply for SSDI benefits, maybe you find out that your SSDI benefits are going to be $1,200 a month. It's important to realize that in that situation, you're probably not going to be able to continue receiving all $1,600 from the private disability policy plus the $1,200 from SSDI. If your plan has an offset requirement, what they'll probably do is you'll receive that $1,200 from SSDI, and then your private plan will only kick in that extra $400 to take you up to that maximum of $1,600. Obviously, those figures will vary depending on your income and how much you've paid into Social Security and how much your plan is going to pay out, etc. But usually when there's an offset requirement, the private policy only pays that extra amount to take you to whatever your maximum was. So, some people get kind of caught by surprise and they, assume, okay, well, I thought I was going to get all of the money from my private plan and all of the money from SSDI, and unfortunately that's not how it usually works. So in addition to private disability plans, a few states have state disability insurance options as well. So some states have decided to implement state disability insurance, which is also called state short-term disability insurance programs or temporary disability insurance programs. And that's done by taking taxes out of an employee's paycheck. So the states that currently have state disability insurance programs are California, Hawaii, New Jersey, New York, Rhode Island, and Puerto Rico. Puerto Rico is obviously not a state, but we're still going to count it here. So generally, in order to be eligible for state disability insurance, you have to have been actively working or seeking work when the disability occurs. You generally have to have earned a certain amount from which SDI, state disability insurance deductions, were withheld. So you might not have had to pay in a certain amount of money into the taxes, but you have to have had a certain amount of wages from which taxes were taken out for state disability purposes. So in California, for example, you have to have earned at least $300 in the last year, approximately, from which SDI taxes were taken out. And then you usually also have to comply with some sort of medical certification to show that you actually do have a disability. So not everyone in a given state, if you live in one of these 5 states, not everyone in those states is automatically eligible for SDI because you do have to have had SDI taxes taken out. So for example, some teachers, they might be paying into a different disability fund, which means that they would potentially not be able or eligible for these state benefits. So one way to double check about whether or not you actually have been paying into SDI is to check your pay stub. It should be a separate line item under one of the many taxes taken out of your paycheck. And if that's still not clear, you can always talk to your HR department, and they should be able to tell you for sure. So, just a little bit more of an example here with respect to state disability insurance. I'm going to use California as an example because that's where the CLRC is currently located. But state disability in California, SDI in California, lasts up to 1 year. I think in a couple other states it might only be for up to 6 months, but here it's up to a year, and you're eligible for up to 55% of your wages. So the requirements for SDI in California are that you have to be unable to perform your regular or customary work and have to have had a loss of wages. So if you go out on medical leave, for example, but you have a whole bunch of accrued sick time and you're using that sick time to cover your medical leave, at that point you have not yet had a loss of wages. So it wouldn't be until your sick time ran out that you would potentially have that loss of wages. So you wouldn't be able to be out using your sick time and also receiving SDI, because that would take you over 100% of what your current wages were. You do have to be able to unable to work for at least 8 calendar days. So if you're only going to be out for 3 or 4 days, but you've already used up all of your sick time, unfortunately, they don't pay until after the first full week of disability. You do have to file a claim within 49 days of the beginning of your disability, and that's where we've seen a few people run into issues because maybe they didn't even realize that the program existed, or the first month or two of their cancer diagnosis and treatment, they were just completely unable to deal with any of these financial issues. So it is really important, and not just in the state disability insurance context, but with respect to any financial issues that you could potentially be facing as a cancer patient, or as someone going through treatment, or even as a cancer survivor, it can be very overwhelming to deal with some of these government agencies, or even to just deal with the bills that you're receiving. So it's a really good idea if you have a trusted friend or family member who you can rely on to potentially help you with some of these things. That can really take a lot of the burden off of the patient, him or herself. Because, like I said, we do get calls from people who they just did not have it in them, they didn't have the energy or weren't able to focus to deal with filing for state disability. And if you miss that deadline, it can be really difficult sometimes to try to access those benefits. And that's a pretty big loss if you're not able to get 55% of your wages just because you missed a deadline. So, we really recommend trying to talk to a friend or family member or someone else who might be able to assist with some of this paperwork if you're not able to do it yourself. Okay, and then just the last little bit here about state disability in California is, like I said, you do have to have earned at least $300 from which SDI taxes were withheld during the previous 12 months. So some of this stuff varies from state to state, but there are only 4 other states that offer this right now. And if you have more questions about state disability benefits in your state, you can always contact the CLRC, or and we'll be happy to put you in touch with the right agency. Okay, so moving along from, we talked about private disability insurance, state disability insurance programs. Now, the federal government does also have these long-term disability insurance programs. Private disability insurance can usually be either short-term or long-term. These state programs are universally short-term programs, so usually only up to a year, whereas these federal programs run by the federal government are only for long-term disabilities. So there are two programs, Social Security Disability Insurance and Supplemental Security Income. Both are overseen by the Social Security Administration, and there are some similarities, but also some really big differences between the two programs. So the similarities are that, at the very least, they do have the same definition of disability. So according to the Social Security Administration, in order to be considered a person with a disability for SSI or SSDI purposes, you cannot be able to work due to a serious medical condition that is expected to last for at least a year or result in death. So the key to qualifying for benefits is to show how your medical condition is keeping you from working. This is why it's important to work with your medical providers to document your medical history. And it's also really important to appeal any denial of benefits because the system is set up to deny people. And your chances really greatly improve as you go through the appeals process. But the important thing to keep in mind here is that the definition does say no substantial gainful activity, which basically means that you're not able to work. But to dig a little bit deeper into what that means, according to the Social Security Administration, someone in the year 2015, so this year, people are considered to be performing substantial gainful activity if they are earning at least $1,090 per month. So if you are going through treatment, you are struggling to, keep enough hours at work, maybe you're only making about $500 a month right now because your hours have been so reduced. This definition doesn't mean that you absolutely cannot work at all. So if you're in that situation where you are maybe only making $500 a month, that doesn't automatically preclude you from being eligible for benefits. If you are making more than $1,090 per month, then they will likely say, well, no, she's working, she's making substantial gainful activity. But if you're making less money than that, it's not an automatic no just because you're working. So hopefully that's clear. And that substantial gainful activity amount does go up each year. Last year it was $1,070. The year before I think it was $1,040. So it's been around $1,000 per month for the last several years, but it does go up every year, and you have to be careful about how much money you're making when you are looking to apply for benefits. So the SSA, Social Security Administration listings, are a good source to look at the types of information that can and should be included in an SSDI or SSI application. The listings include conditions that the Social Security Administration has already determined likely to affect a person's ability to work. The more that you can focus on the conditions that exist, and the more you can make the case that the conditions prevent a person from working, the better chance you have for an application going through the first time. So if your medical record is really long or if it's incomplete, a doctor's letter can actually greatly help to sum up the key issues or explain what some of the lab results, etc., might mean as it pertains to your ability to work. Your doctor should be familiar with the language in the Blue Book and mimic it when it applies to your condition, if that's appropriate. So the Social Security Administration is looking for medical evidence that you are disabled, not a recommendation from your doctor that you be determined disabled. So that's the key point there. So if your doctor just writes a note saying she's disabled and should be eligible for benefits, that's not going to be helpful. The Social Security Administration doesn't care about what your doctor thinks should happen with respect to benefits. They care about why your doctor is saying that your condition makes it impossible for you to continue working. How is your condition preventing you from working? That's where your doctor is going to be helpful. So sometimes we get questions because the Social Security Administration is notorious for taking a very long time to process applications and either give denials or approvals for benefits. So we do get questions about, okay, well, is there any way for me to expedite my application? So there is a program called the Compassionate Allowances Program. It began in 2008, and it is a way of quickly identifying medical conditions that are presumptively eligible for Social Security disability benefits based on minimal objective medical information. So if you have a condition that falls within one of the conditions that is explicitly listed on this list, make sure that that is obvious in your application, because this can greatly reduce approval time. So there is a list that is updated frequently. I think it's updated at least once a year, and it's at ssa.gov/compassionate allowances. And I just want to make it clear that this is not a separate program that you have to apply for. It's just another, it's one way that they use to sort applications as they come in. So if you have, for example, breast cancer, and all of your medical evidence shows that you have breast cancer, it might not, you wouldn't necessarily qualify for the Compassionate Allowances Program where you would have an expedited application unless it was clear that you had distant metastases, inoperable, or unresectable. That's how they refer to it. Essentially, you have to make it clear what stage your cancer is at, and usually that is pretty clear in the medical record, but certain types of cancers are listed under this Compassionate Allowances Program, but what stage you're at is really going to make the big difference as to whether or not you can get your application expedited or not. And when I'm talking about expediting, usually that means that they will give you a determination within 1 week as opposed to maybe 5 or 6 months or longer. Some of the offices are extremely backed up with applications, so it's very important that if you do have a condition on this list to make that very clear in your application, because it can save so much time for you. Okay, so Social Security Disability Insurance, SSDI, is based on your work history and how much money you've paid into the system through your Social Security taxes. Typically, the amount of your monthly benefit is based on your average lifetime earnings. The statement that you receive every year from the Social Security Administration, and I think they might have stopped sending these out by mail, but you can absolutely call the Social Security Administration or create an account online, and that can usually be the easiest thing for people is to create an account online. And then you can go in and check, and it's updated every year to tell you how much money you would receive if you became disabled today and how much money you would receive if you retired. Excuse me. So because it does vary depending on your work history, it's going to, and how much money you've paid in. If you made $1 million a year, your benefit check is going to be more than if you had only made $100 a year. And the monthly maximum benefit is approximately $2,500. In order to collect SSDI, if you're over 31 years old, you must have worked for 5 out of the last 10 years and paid into Social Security during that time. Basically, if you have a prior work history and you've paid into the system, you are potentially eligible. But if you stopped working 15 years ago, you probably won't qualify for SSDI, even though you would still potentially be eligible for Social Security retirement benefits. So it has to be recent work history. We do get calls sometimes from people who say, well, you know, I did, excuse me, I did work for 20 years. I paid into Social Security that whole time. But, you know, then I stopped working when I had my children, and I've been, you know, taking care of my kids for the last 10 years. But now I just found out that I have cancer, and now I want to apply for SSDI. Will I be eligible? Well, unfortunately, if that person has been out of the workforce for the last 10 years, not paying into Social Security disability, not paying into Social Security at all, potentially they're not going to be eligible for SSDI because their work history is not recent enough. But later down the road, when they want to apply for Social Security retirement benefits, that previous work history would make them eligible for that. So under the law, if you become eligible for SSDI payments, your payments cannot begin until you've been disabled for at least 5 full months. Payments usually start at the beginning of the 6th month of disability. So this is to ensure that people are not being paid out for short-term disabilities. Like I said, these programs are for long-term disabilities. Unfortunately, you are not entitled to benefits for any month during that 5-month waiting period. So everyone on SSDI has a 5-month waiting period. That means that even if you have one of those conditions on the compassionate allowances list, you are not eligible for benefits for the first 5 months of your disability. So if you become disabled January 1st, it doesn't matter if you find out on January 1st that you have stage 4 breast cancer, or if you, it doesn't matter how intense your disability is, how debilitating it is. For the first 5 months, you do not get benefits. So the other thing, though, to keep in mind is that retroactive payments are possible back to the date your disability began, up to 12 months prior to your date of application. So let's say that you actually became disabled on January 1st of 2014, and then you didn't apply until much later. You might not get benefits for those first 5 months, but if you applied much later than when your disability actually began, you might get retroactive payments. I'll talk a little bit more about that on the next slide. The other really great thing about being on SSDI benefits is that you are eligible for Medicare after 2 years of being on SSDI. So sometimes people think that that's automatic, like as soon as you become eligible for SSDI, you get to go on Medicare. Unfortunately, that's not the case. You do have to wait 2 years, but it's still better than having to wait until you turn 65, which is how most other people have to wait to get onto Medicare. Okay, so let's clarify the retroactive payment situation. So let's say that you have a disability that began on May 1st of 2013. You applied for SSDI on January 1st of 2014, and then received your first SSDI check in June of 2014, because let's say it took them a while to process your application, et cetera, et cetera. So when you receive that first check, it is going to be for 8 months worth of benefits, because if your disability began May 1st, you wouldn't get paid out for May, June, July, August, or September of 2013. So your first payment theoretically should have started October 2013, but because you didn't apply until later and it took them a while to process, then you would receive that payment in a lump sum, usually for October through May of 2014. And then you would start receiving regular checks each month just for that individual month. So, again, no payments during that first 5-month waiting period. Okay, so on the other hand, now we have Supplemental Security Income. SSI is not based on your work history. So for, going back to that woman who maybe worked for 20 years and took time off to take care of the kids, it wouldn't necessarily matter that she hadn't worked recently. She might be eligible for SSI if she has, if she meets the other eligibility criteria. So it's only based on whether or not you meet that definition of disability that we talked about and your assets and income. So where SSDI is based on your work history, SSI is based on lower income and asset level. So the amount of your SSI benefit would depend on where you live. The basic SSI check is the same nationwide, but some states do supplement that. And I think for 2015, it's around $733 per month. And then depending on where you live, your state might supplement that as like a cost of living increase and that sort of thing. So, whereas someone on SSDI benefits can vary really widely depending on how much money you've paid into the system. On SSI, everyone in your state on SSI is going to be receiving the same amount of money, basically. So eligibility standards for SSI can make you presumptively eligible for Medicaid as well, or your state's Medicaid program. In California, it's called Medi-Cal. So if you're found eligible for SSI, you will most likely also be eligible for Medicaid. In some states, you won't even need to do a separate Medicaid application. But, we do generally recommend applying for both at the same time if that's possible, because SSI applications can take a lot longer to process. The other thing to keep in mind about SSI is that unlike SSDI, there is no waiting period. So SSI benefits typically pay after the first month that you are determined eligible. So sometimes people will apply for both programs, and if they have very low income and assets, they might receive SSI for those first couple of months, those first 5 months potentially, and then once that's over, or once their waiting period is over for SSDI, then they would switch over to SSDI. So you can apply for both. You can be eligible for both, but usually once you start receiving SSDI, your benefits are high enough that you would no longer be eligible for SSI because of your income. So under some specific circumstances, there are some special rules that do allow people receiving SSDI or SSI to work and still receive their cash payments until they can fully return to work. So, some people might look at these programs, SSI and SSDI, as, oh, well, that's only if I'm going to be permanently disabled. Oh, this means I'm never going to go back to work. For some people, that's true. Some people don't ever, regain the ability to go back to work. Other people, on the other hand, maybe they have a couple of really rough years where they are, going through a lot of treatment and trying to get their strength back, etc. But maybe, after the end of their treatment, once they've, had some additional time to regain their strength, maybe often people are able to go back to work, or at least to try. So when you are attempting to return to work, you generally are able to keep your full cash benefits, you keep your Medicare or your state, Medicaid. You might also be able to receive help with education, training, and rehabilitation. So the trial work period is something that it lasts up to a total of 9 months within a 60-month period. They don't have to be 9 months all in a row, but it is 9 months within a continuous, 60-month period, so within 5 years, basically. And it's important to remember that it doesn't have to be all these months in a row, because sometimes people, they'll get an odd job here or there. They start making more than substantial gainful activity, that $1,090, and they might forget that, okay, well, they've already done this 8 other months within the last 5 years. So it's important to keep track of your earnings if you are on SSDI or SSI, because once you've used up those 9 months within a 60-month period, you do face the potential for losing disability benefits. You're not necessarily automatically going to lose your benefits, especially if you become unable to work again. There is this 36-month reinstatement period. So, it's a little bit more complicated, but it's just important to keep in mind that you can go back to work. It's just important to keep track of what your earnings are. And if you realize, you tried the trial work period, it's not working for you, you're really not able to maintain a job, then at that point you can stop working and your benefits would resume. So as I mentioned earlier, the Social Security system is set up to deny people. So it's really important that people appeal a denial from Social Security instead of filing a new application. Because if you file a new application, you're basically just starting the clock over, because they can only give retroactive benefits back to up to a year before your date of application. So if you file a new application, you're potentially reducing the amount of back benefits you could get. And you're also just starting the whole process all over again, whereas with the appeals process, the more you appeal or the further you get in the appeals process, the more likely you are to potentially get approved. So the Social Security appeals process has 4 levels. The first is a request for reconsideration, and some states have eliminated the request for reconsideration. So in some states, you might go straight to the second level, which is a hearing by an administrative law judge. After that, there's a review by the Appeals Council, and then there's federal court review. So according to the National Organizations of Social Security Claimants Representatives, no more than 37% of applicants are initially accepted. So that's a pretty low number. I mean, it's barely a third. However, after appealing their claims, upwards of 54% are possibly approved. So if you appeal through the process, you have a much better chance of getting your claim approved than if you give up after getting denied the first time. It's very important too, during the appeals process, you can always update the Social Security Administration about any changes that you've had to your health status. So, if things have gotten worse, you can add that information to your application, and it's going to make it more likely that you'll get approved during that appeal. And we do get questions from callers about hiring an attorney for Social Security disability applications. I would say generally, in the initial application process, it's probably not necessary to have an attorney help with that initial application. But once you get to the appeals process, that's usually when an attorney will potentially get involved, usually at that second level, the administrative law judge level. Now, whether or not you want to hire an attorney to help you is really up to you. It can be very useful at that appeals level with the administrative law judge to have an attorney. And if you're concerned about paying an attorney for their services, generally it's all on a contingency basis, which means that they don't get paid unless you win. And there is a cap on how much Social Security disability attorneys can get from helping you with your disability case. So the statutory cap fee is $6,000. So that means that a Social Security attorney cannot charge more than $6,000 for their services. And generally, when the way that they get paid is from any of those back benefits that you are potentially eligible for. And obviously, as you continue on in the appeals process, the longer that goes on, the more back benefits you potentially have coming to you. So if we, take that example again where the person became disabled in May of 2013, didn't apply until January 2014, if that person had gotten denied and started appealing, that can take, maybe a whole another 6 months, another 8 months, another 9 months. So, once that's been going on, if they do eventually determine that that person was disabled all the way back in May of 2013, that means that they might have a lot of back benefits coming to them. So that's where the money for the attorney usually comes from those back benefits. Okay, so here are a few of the practical aspects of applying for SSI or SSDI. It's important to have a conversation with your healthcare provider. Tell your healthcare provider that you're applying. Can your doctor or other healthcare member provide other evidence? It's important to check your medical records and see what they say, because sometimes you'll go to the doctor and the doctor will write into the medical record, oh, she's doing so much better, she's doing, she can go back to work now, or, something about how your condition has improved. That might be great for you in that moment that you are improving, but it is not going to help your disability application. So it's a good idea to talk to your doctor if you're thinking about applying so that they potentially won't write things like that down in your medical record. It's also important to be a strong self-advocate and to include all of your medical issues in your application. So maybe your cancer is the primary reason why you are no longer able to work, but maybe you've also, had a history of having a bad back, and you've also been dealing with depression as a result of your diagnosis. If you're seeing a bunch of different doctors, or if you've had, other ongoing conditions or illnesses, it's important to keep that in mind, because they are going to be looking at the big picture. They're going to be looking at you in general. And so it's, the more evidence that you can give them about why you can't work, the better. So I will be posting these slides on the website just so you're aware. But, some resources, the Social Security Administration, the National Organization of Social Security Claimants Representatives is a good place to look for an attorney to help with disability appeals. Okay, and then really quickly, I'm going to go through a couple of financial assistance options. We do have a financial assistance handout on our website that is pretty useful, and we are trying to update that shortly. So we'll be posting the updated version hopefully by the end of the summer. But unfortunately there are no quick fixes when it comes to financial assistance programs. But by reaching out to as many different sources as possible, you might be able to add up enough to make ends meet. So there are some programs that provide health insurance premium and copay assistance. A couple of these options are Cancer Care, Patient Advocate Foundation, Leukemia Lymphoma Society. A lot of these programs are diagnosis specific, so it's really going to depend on what type of cancer you have to see whether you're eligible for certain programs versus others. And sometimes programs would rather pay COBRA premiums or other healthcare costs as opposed to just giving a cash donation automatically. There are also a lot of prescription assistance programs, and we also have a prescription assistance handout on our website. If you're struggling to pay for your prescription drugs, you might be eligible for various discount programs like Needy Meds or AARP's prescription drug discount plan. In addition, certain drug companies, or many drug companies, offer assistance programs for people with limited financial and insurance resources. Their eligibility requirements do vary, so it's a good idea to check their websites for what their criteria is. And you can also ask your doctor and pharmacist, because sometimes the doctor can give you samples of the medication for free. Sometimes the pharmacist might know about other discount programs. They might have coupons for various medications. Usually the pharmaceutical companies also have some sort of coupon or discount. So it's a good idea to double check if you're having difficulty paying for your prescription drugs. There are also various religious-based assistance programs, many of which do not require the recipient to actually be of a certain denomination or belief system. So the United Way, for example, pulls together financial and human resources to address issues for patients. And then there's the Association of Jewish Families and Children's Agency that sometimes will provide forms of financial assistance as well. And then, of course, there's also a number of other local programs that might exist. These programs might not provide direct cash assistance, but using them for services like food, various food banks or something like that, or clothing, can help reduce your overall monthly costs. And so if that frees up money on one part of your budget, then that means that you might be able to use that money towards some of your healthcare costs if necessary. One thing to keep in mind about food stamps is that sometimes if you're eligible or if you're on SSI or some other disability program, you might not be eligible for food stamps. That's how it is in California. But it's important to look into all of your options to see what you may or may not be eligible for. And obviously it can be pretty hard to ask for help, but often you'll find that people really do want to help you, your friends and family. Most of your family and friends probably feel pretty helpless with respect to your situation and your, when they heard about your diagnosis. So, asking or letting people know about your specific needs can be very helpful, both for you and for them, so that they don't feel quite as helpless. One really important thing to note, though, about if some of these websites like GoFundMe or Give Forward or My Lifeline, if you are applying for need-based government assistance programs like food stamps or SSI, it can be better to ask friends or charities for an in-kind donation rather than cash. So that means that that they're giving you food directly, or they're paying a bill for you directly instead of just giving you cash, because if you deposit that money into your bank account, they might see that takes you over the asset level for some of these government programs, and that might make you ineligible for the program, which sort of defeats the whole purpose of either of these forms of assistance. So if they gave you money directly by paying your medical bills or paying your rent, sometimes it's not counted as income if they're paying that bill directly. But if they give it to you for you to pay the bill, then that might be considered income. So it's important to double check with the various programs that you're trying to apply for to see what it is they do or do not count as income. Okay, so I'm sorry that we do have a couple other places to look here. Obviously, I mentioned our website. The American Cancer Society also has various resources that they have put together. And I'm going to try to answer a couple of questions here before we terminate. But thanks so much for joining.